Happy to be here today. Gosh, could we have had a better morning with some of the giants of our, of our profession laying the groundwork for some of the airway-centric issues that our patients are facing? If we didn't think airway was a big deal, after this morning, we know what a big deal it is. So I'm very humbled and excited to be here to talk to you guys about some real world, what can we do Monday morning when we go back to help these kids? Because as I said this morning, once you see it, you can't unsee it. Once you recognize these signs and symptoms in kiddos, you're going to be hopeful and motivated to help them. So a few disclosures. I am a clinician and lecturer for Orthotain by the Healthy Start System. I'm not receiving compensation for this presentation. Advice and outcomes based on peer review research and my clinical experience. If you want more information, you can go to centraldentist.com, chillumbrello.com, or visit the Healthy Start booth outside. So we always like to talk about the why, right? What's the reason why? Here are my 4 kiddos here. Probably the cutest kids you'll ever see. Not that I'm biased, but pretty good kids. Here's my why. I'm a 4th-generation dentist. I had the pleasure of being treated by my father by some of the appliances that I'm going to show you here today growing up. He gave me the ability to breathe right, to sleep right, and not have to wear braces. And I'll tell you, it served me pretty well in my life to be able to sleep well, especially as I'm in the driveway having happy hour with my girlfriends, as Dr. Gelb said, the Peloton, riding girlfriends who are exhausted, the young fit females who look great, beautiful smiles, very fit, but they're dying. They're exhausted, right? And so I want to help my friends for sure, but more importantly, I ask my friends, because my friends aren't the best patients, let's be honest. I mean, they're drinking wine in a driveway. How good could they be, right? So I say to my friends, wouldn't you like something better for your child? Don't you want something better for your child? So these 4 kiddos are a huge motivation. I'd like to give them the same future that my father gave me as far as improving my health and my ability to sleep and breathe. I also, not to get political, but gosh, guys, the world's kind of a crazy place. If we're going to change it and have it get better, I've given up on my generation. So let's look to these kids. If we can make the kids the absolute best versions of themselves, maybe this world won't be so crazy in 20, 25 years. I don't know. This kid here, his name's Gino. He's my 3rd. If he's in the world in 2025, it's going to be crazy. I just got a picture. He's currently at home. They're homeschooling today. He's on the trampoline and rollerblades playing rugby with a hockey stick. So, we can only help these children so much. So today I'd like to talk about some outward signs and symptoms. I'd like to talk about the common root cause. We've heard a lot about the symptoms this morning, and so let's really hone in and identify what's causing those symptoms. I'm going to talk to you a little bit about present-day diagnostic technology and methodology, things that I'm currently doing in my office. I've been doing this a little over a decade. When I started, I didn't have any of the equipment. I didn't have some of the fancy diagnostic tools that I call them fancy, I consider them fancy, that I'm using today. So as I show you some of these diagnostic tools, let me please let you know, hey, this is something you can do on Monday. You don't have to have an amazing network of people yet. You'll grow it, you'll develop it, but these are things you can do day 1 when you get back on Monday. I'm also going to show you a couple of cases that we've done, and you can decide for yourself. So a really great study came out in JOAS in the winter of 2016 talking about the incidence of sleep disordered breathing in children from 2 to 19 years old. What was really interesting that came out of this study is that 90% of children exhibit at least one of these symptoms. Here's the other crazy part. 60% actually exhibit 4 or more. These symptoms include things that we heard about this morning: mouth breathing, snoring, difficulty listening, talking in sleep, allergies, ADHD, I won't read all of these to you, bedwetting, right, speech problems. If these weren't issues before, if parents weren't recognizing these issues in 2019, you put these kids at home on COVID lockdown where parents are now their teachers, you better believe parents are seeing all this. With the shutdown, it was tough, let's be honest. I'm from Dallas, Texas. We were mandated closed for 13, 14 weeks. It was tough. During that time, instead of being home working with, I was teaching my kids, but they very quickly realized they were smarter than me, so that didn't go well, guys. But instead of doing that, I was reaching out to parents. How's it going? How's your child doing? Fill out this questionnaire, which I'll show you here in a minute. Do your children have any of these symptoms? Let's talk about how we can help this, how we can resolve it. Parents were desperate for solutions to problems that teachers were relaying to them during parent-teacher conferences, symptoms maybe they saw after school, but they didn't realize how hard math was. They didn't realize how hard history was for their kids. Now they're home teaching them, they're putting them in front of the screen, their kids are going crazy. There has never been a group of people that appreciate teachers more than the parents that have been homeschooling for a year, right? Never, ever. So these parents, while I'm home and closed, I'm reaching out to these parents in an effort to educate, in an effort to help. Hey, here's something you can do to make it easier to learn at home. These parents are desperate for solutions. And guess what? We're going to talk about some of the solutions we were able to introduce with them, as well as digitally monitor their patients. So even though we were closed, we were able to continue to treat patients, which also helps from a production collections point. That's not why we're doing it, but it does help. Now with this study, really important findings, the take-homes, mouth breathing and snoring are associated with sleep disordered breathing more than any other symptom. For the 4 to 12-year-olds, 93% of these symptoms did not self-correct. Actually, 30% worsened with age. Wow. So how about the pediatrician? How about the child who comes in, who's grinding their teeth and snoring, and I ask the parent, I notice wear on this child's teeth. I notice this kid, probably is snoring a little bit. I know you think it's cute, but I saw your video on Instagram of your kid in the car snoring. I actually don't think that's cute. Oh, pediatrician said that they would grow out of it. The teeth grinding, we don't know what it is, but we'll grow out of it, right? Well, actually, I point to this study all the time. You know what, 93% of the time, they're not going to grow out of it. Would you like to take the chances that your child is part of that 7%? I don't. As a mom, I always want the odds in my kid's favor. So this is a really important point that you can educate parents because they're getting different information, misinformation from other providers, but they sometimes see us more often. So what we're going to take away from this is that sleep disorder breathing symptoms are very common, affecting children as early as 2 years old. We heard that this morning. No longer are we going to wait. I forget who said it, but the 8-year-olds in the orthodontics, they've waited too long. We want to look at them even sooner. If we can have an early intervention, which really goes well with the philosophy of this group, that's why I love being a member of the IOMT. The earlier we have an intervention, the more holistic, the non-invasive we have to be for a more long-term solution. My goodness, sign me up every single day for that. So I think that our patients, the like-minded patients who are looking at you for safe mercury removal and are looking for more holistic options and products and that type of thing, this line of thinking bodes really well with those parents. They don't want to wait and have surgery. They don't want to have metal and acrylic in their mouth. They want to have something removable that promotes their natural growth and development by eliminating the symptoms that have deviated that growth and development to begin with. Hey, let's fix the root cause. Your child is perfect. Let's fix the poor oral habit that maybe they have, put them back on the path of growth and development that they're supposed to be on, and then just gently guide them all the way through. How does that sound? Yes, sounds awesome. Once we start introducing metal and acrylic and some of these other appliances that work, don't get me wrong, but once we start introducing that, now we have to do materials testing, biocompatibility testing. Now we're talking about oral galvanism in the mouth with all the metal and that type of thing. These are tough conversations to have with parents. I don't know about some of your parents. A lot of my parents, they draw a line in the sand. Absolutely not will I have metal in the mouth. Absolutely not will I have surgery. So having another alternative has been very productive and helpful for the parents that share that philosophy. Identifying the outward symptoms displayed is really important. Well, how do you start looking at that? I'll tell you, once you see it, you can't unsee it. There's some kids at the pool. I was eating lunch, it was nice lunch today, eating lunch, looking at the pool. There's like 4 mouth breathers playing in the pool in the shallow end, right? I can't unsee it. What should I see? A beautiful sunny Florida day, right? A beautiful lunch that's been prepared and served me. I don't. I'm like, ding, 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 mouth breather. That's an issue, right? So you're going to start seeing this in your own children. It's a bit aggressive. Thank you for laughing. It's a bit aggressive, but that's just how my mind works. So you're going to start seeing this in your children and your children's friends and your grandchildren. Everybody knows a child, right? And so we want to start taking a look at that. So we know that a deficient airway can be associated with these poor oral habits. So then we get under optimized head and neck growth and development. Parents understand that. Parents understand that some of these habits are actually not intentional. Some of these habits are the child's way of coping or accommodating for something that they need. And most of the time what we recognize is a desaturation of oxygen while they're breathing, whether it's during the day or the night. The child's ability to compensate for that under-oxygenation is really great. These are very healthy kids. So what they're able to do to pivot is really good. I have a couple cases of not so healthy kids. I'll show you those as well. We know mouth breathing is a big deal. 1/2 inch of an open mouth collapses the airway. 6 millimeters. So in a 7-year-old, the average airway would be about 7 millimeters. This is just a very basic way to show it in a 2D Ceph rather than a 3D CBCT. I'll show you that here in a minute. But with the collapse of the airway, just with a poor oral habit of mouth breathing, can take a pretty decent airway and turn it into the coffee straw. Can take as we heard this morning, take the garden hose and turn it into a coffee straw. Well, how do we get the child to stop? How do we get reestablishment of nasal breathing? How do we get that child to stop mouth breathing? Well, it's an autonomic habit that the child does. So even the pleaser of a child who wants to follow your rules and do what you say, okay, kid, breathe through your nose, right? Okay, she's watching me. I'll breathe through my nose here for a minute. But as soon as the brain kicks in, they're going to open their mouth. Mouth taping is a great way to do that. As a mother, as a dentist and as a mother, I totally understand how great mouth breathing is. I'm not going to tape my kid's mouth. I know how important it is. I'm not going to do it, right? So what are the options? The mom that will tape their kid's mouth, they're going to be one of the most compliant patients in your practice. I love those moms, right? But what about the mom like me that's like, I'm not doing it. What else do you got, right? So I'll show you a series of oral appliances that you can use that are removable, that also reestablish nasal breathing, but don't involve taping the mouth. 2 different options. You have to read the patient. Sometimes I get the compliment that I'm really good with children, that I get great compliance. And I take the compliments, don't get me wrong. I'm not going to correct anybody that compliments me. Go for it, I love it. But what I would refuse to say, hey, I'm actually not that great. I'm actually not that special. I'm just very particular with who I work with. I'm very particular on which moms and which children I work with to make sure that we get compliance. So I think that's really important. Let's take a look at my 1-year-old daughter. Sucking her fingers here. Isn't she cute? She's wearing the standard Texas monogram dress, right? Isn't she so cute? My mom took this picture and surprised me with it. She blew it up real big to hang it up in my office. I cried when I saw this. Here's sweet little Eloise, Venus pulling under her eyes. She has an underdeveloped lower arch. She's sucking her fingers to advance her mandible to open her airway, going exactly the opposite of her natural growth and development pattern. No, thank you, Mom. I don't really like the picture, right? But her dress is monogrammed. I don't care. So we see these pictures on Instagram, on Facebook, of our friends posting, look how cute my daughter is. You know what I would post in my earlier days when I was a bit more aggressive than I am now, just pointing out children at the swimming pool? What I used to do is comment on their social media. This is not cute. Your daughter's dying. She's suffocating. Bring her in immediately. I'll stay late today, right? It was an interesting marketing tool. Sometimes it works. Sometimes I'm not for everyone. I'll just throw that out there. But no, that doesn't work. Don't worry, Eloise is now 3. She's thriving. She has symmetry in the thirds of her face. She no longer sucks her fingers, and she's a little goofball, so she's great. But these are not cute pictures. This is a sign of a little girl in distress who is suffocating, and because she's so healthy and because she's so smart, she has figured out a way to accommodate that by putting her fingers in, putting her thumb in, whatever the case may be. So how about that 9 or 10-year-old or 16-year-old? I saw a 16-year-old this week in the office who still sucks his thumb. He knows that's baby. He knows he shouldn't do it, right? The 9-year-old, he knows he shouldn't do it. He doesn't want to go to the slumber party and suck his thumb, but why does he do it? It makes him feel better. So if we can change the narrative with this kid who's holding all this shame and embarrassment, and I shouldn't be doing this, if we can change the narrative and say, as I said to the 9-year-old that I saw this week, hey, I am so impressed with you. You are unbelievable. I am so proud of you for sucking your thumb. Kid's like, I'm sorry, what? Like, Mom, where did you bring me? I said, I am so proud of you because you are so smart. You figured out a way for you to breathe better so that your smart brain can work better. You've opened your airway so you get more air in through your nose. My goodness, do you need a summer job? I'd love for you to work here and to show people how smart you are sucking your thumb. Kid's like, what are you talking about? I've been shamed and made fun of for years for this. And then I say, hey, but you and I both know you can't suck your thumb, right? We don't want your dirty thumb in your mouth, and your friends probably make fun of you. So let's figure out a way that we can help you breathe just as well as you do with your thumb so it feels good. We're not breaking your habit. We're going to replace your habit that helps you achieve what you were already so smart to figure out. Mom, what do you think? Aren't you so proud of your kid for sucking his thumb? And Mom's like, yeah, I've been chastising him for years. I'm so proud, right? It switches that dynamic. It switches that conversation. Do you think that 9-year-old is going to do whatever I ask? Heck yeah, I'm so proud of him. He comes in, this is my favorite thumb sucker. How are you, buddy? Throw my arm around him. Hey, how's it going? He's going to use whatever tool I give him to help. And by the way, you can't break the habit. Anybody tried, breaking habit's terrible. I tried to break a coffee habit. So I replaced it with like tea, and it didn't work. Now I have like a really booming espresso habit. I've just replaced it with something more terrible. It's hard for these kids to break the habits. But if we replace it with something that feels as good and achieves what the habit was supposed to do, maybe they can be more successful. There's maybe a little life lesson in that as well for them, a little bit of accountability, a little bit of becoming their own advocate, stepping up. I think that's important. Those are important roles for children to develop at a young age, so when they're adults, they can do that. Maybe if everybody had a little bit more accountability, maybe if everybody had a little bit more ability to be their own advocate, the world would be a different place. So in my office, I have this chart here laminated. We call it the circle of death, because when you're talking with kids, that's how you want to brand things, right? The circle of death. How do they end up on the circle of death? We see children that are mouth breathing and snoring. Why are they doing that? We're getting extended bottle feeding and pacifier use. Guys, check your mom guilt at the door. There's no mom guilt. If you breastfed, if you bottle fed, no one gets a trophy. I came to find out after 4 children, no one gave me a damn trophy, right? I earned one and no one gave me one. Who cares? As long as your child is healthy and fed and it works for your family. That being said, if bottle feeding was one of the choices that worked best for your family, the musculature has to be accounted for. So no problem, bottle feed your children, but now let's build up those muscles that maybe didn't get the development if they had been breastfed. We see cases of poor tongue posture, abnormal swallowing, sugar, processed foods can have an effect. Then we get the poor oral habits, finger sucking, thumb sucking. Has anybody gone to the child's food aisle at Whole Foods even? Whole Foods or Target? All of the food, even at Whole Foods, it like dissolves on your hand, right? We are so afraid of these children choking. So like when I would buy food for Eloise when she was little, I was like, okay, here it is, hurry, I'm gonna throw it at you because it's gonna dissolve on my finger before I can give it to you, right? Because we don't want them to choke. Absolutely not. Eloise, here's some beef jerky, homegirl, have at it, right? I'll see you in 20 minutes after you've worked your jaw muscles and that type of thing. But everything that's convenient, everything that tastes good, and everything that's marketed to children is dissolvable, has high fructose corn syrup, highly processed. It's tough. It's tough to buy, have those things available. We then get a compromised airway. So if we're not getting enough oxygen and we get an increase of CO2, of course that's going to affect brain function, immune and endocrine system. So we have these little kids who are trying to function, trying to grow and develop. They don't have the right ingredients. I like to tell parents, because this analogy usually works, if your child were to wake up and we were to give them a Coke and cotton candy for breakfast, and the mom's like, oh God, I would never do that. I mean, there was this one time, but like we never did it again, right? For sure, that child would go out into the world, would go to school, would see their friends, and live their life, right? The same child wakes up, and we give them a healthy breakfast, whatever that means in their house, an egg, some protein, toast, green smoothie, whatever. That same child goes out into the world. Those two versions of the same child are so very different based on the ingredients that we put into their body. It makes so much sense when we talk about food and diet and that type of thing. But it's the same concept when we talk about their oxygen levels. If they have complete oxygen desaturation all night long, this kid is sleeping like cotton candy and Coke. Parents are like, oh gosh, that makes sense. It's a very simplified, probably oversimplified analogy that falls, flat on a group of very smart doctors in this room, but on parents, when they're thinking about that, it's something that really resonates. Once we start getting affected brain function, immune and endocrine, we start seeing swollen adenoids and tonsils, low tongue posture, tongue thrust, underdeveloped dental arches, open bite, cross bites. That then leads into all these symptoms that parents are looking all over trying to get solutions for: restless sleep, ADD, bedwetting, etc. Now, a lot of these parents will say, oh, it must be just, genetic. I snore, my husband snores, I have ADD, I've been on medicine for 30 years, I have, and you start hearing that this is just the reality. And so one thing I like to say, now I'm a general dentist, I treat everybody. I treat kids, I treat adults. I don't really love the millennials. Technically I'm a millennial, but I don't really like that generation. But I treat them anyway, right? I don't turn them away. But I treat everybody. But what I say to some of these parents are, hey, I understand, and that sounds terrible. I'm sorry that's your reality, and I'd love to set up a complimentary evaluation where we talk about how we could potentially help you. But today, here's what I'd like to ask you. Don't you want better for your child? Wouldn't you like if your child didn't have to go through the same symptoms, the same reality that you have? Yes, I would. All right, so let's take a look at some of these root causes. Everybody recognize this guy? It's kind of a fleeting analogy, Napoleon Dynamite. If you haven't, could you please see the movie? One of the best movies of all time that was ever made. But when we take a look, no one's seen this movie? Oh, thank you. Okay, where am I? Yeah, come on, guys. It's a great movie. So research over the last 20 years has linked all of these outward symptoms to these 4 root causes: mouth breathing, narrow palate, improper tongue placement, and jaw relationships. Just like we saw this morning, these are root causes. So hey, I'm actually not going to treat your teeth grinding. I'm actually not going to treat your your endocrine imbalance. I'm not going to treat your adrenal fatigue. I'm not going to treat your gluten insensitivity, your nasal inflammation. We're going to treat these root causes, and then those symptoms go away because your body doesn't have to accommodate for that anymore. It's much more straightforward. Common treatment options. I'm in Dallas, Texas, kind of in the heart of Dallas. I see patients every single week who are coming in having some of these treatments ongoing. Hey, this isn't working. What other options do I have? Or these are the treatments that have been presented to me, but I'd like a more holistic, early intervention, non-invasive approach. We're seeing psych testing, surgeries, sleep aids, diet changes, rapid paddle expanders, and the prescription medications. The amount of prescription medications that the kids are on that come through the practice absolutely blows me away, because with every medication there are side effects. And then we get a medication to treat the side effect, and then to treat the side effect, right? These little kids, and I don't just see healthy children. I see some really sick children that have gone on a whole adventure of different therapeutics that haven't worked. So parents really like to hear, hey, listen, let's simplify this. Let's roll it back. As my favorite philosopher Taylor Swift once said, Band-Aids don't fix bullet holes, right? Anybody a Taylor Swift fan? This might be the wrong demographic. Thank you. We should be best friends after this. You've seen the same movies and you listen to the same music. This is great. Yeah, exactly. Yeah. So these conventional treatments are just treating the symptoms. They're not treating the root cause. So as we're talking to these parents and we're trying to educate them and they feel overwhelmed, because all they want to do is help their kid. As parents, all we want to do is help our kid, right? And they're getting these options that aren't working. They're exhausted. By the way, when we look at some of these symptoms that the kids are having, ADD, right? Not sleeping well, wetting the bed. Gosh, the dynamics of that family is pretty exhausting. I'll tell you what, guys, I told you I was treated with these appliances. I have a brilliant airway. I sleep beautifully, not to rub it in, and I'm barely making it. So I have a lot of empathy for people that don't sleep well, and how you make it through the day-to-day, how people are nice to each other. Like, I'm sleeping great, and I almost yelled at someone on the elevator. Like, what is with that, right? So I think it's really important that we, hopefully that person's not on here, but I mean, she kind of deserved it. So these are addressing symptoms only, not the root cause. They're short-term, they're costly, painful, time-consuming, ineffective, and they also involve several drugs without side effects. So what can we do as dental professionals? What can we do in our office? We have the expertise in comprehensive head and neck development, right? If we didn't have it before, after listening this morning, I think we have it now. We got some really great insight in head and neck development. We have tools to treat airway disorders. We have relationships with families. We're able to sit down and talk with them and perhaps spend more time with them than their pediatrician, than their ENT who's approving them or not approving them for surgery, potentially based on their medical insurance reimbursement, right? Ooh, how bitter was that comment? With their therapist, some of their speech therapy, some of the even myofunctional therapists in Dallas have been digital, have been Zoom meetings. That's a really tough way to teach somebody to move their muscles and to talk to them. So it's nice that we have that time. We also have the capacity to educate and guide patients. This is not a doctor-centric educational model. The education of our patients start right as they walk in, right? When we have our front desk girl, she's the first one. Oh gosh, we got a mouth breather in the waiting room, right? We got a mouth breather, and they have a mask on. I'm like, how do you know they're a mouth breather? Oh, I can tell, right? So we can include our whole team on that. It's not about cavities and straight teeth anymore. It's looking at their overall well-being, how everything goes together. That's why this resonates so well with IOMT, because we are looking at the whole body, how it all works together, not just one aspect. So let's talk a little bit about the diagnostic tools that I'm currently using in my office, things that I've grown into, and I'll also remind you of things that I did to begin with. So I'm using a symptom survey with a clinical exam, clinical photos, a Pano CBCT, ortho records and measurements, a home sleep test. I graduated into that. I used the sleep stat and the Knox T3. But you know what? Not everybody wants to wear those. Not everybody's compliant. We use sleep apps on the phone. We even use a Fitbit. I don't know if you guys have Gizmos. Gizmos are kind of the new cool thing for kids ages 7 to 10. The Gizmo has those on there as well. So it's not necessarily to have this diagnostic test that we're going to submit to insurance for reimbursement. No, it's a screening tool. Hey, is there potential that your child doesn't sleep as well as they could? No, they're fine. I put them to sleep and I don't see them until the morning. Okay, but is there potential that something could be happening in the night that you don't know about? I don't know. Hey, here, borrow this Fitbit. What? Yeah, we have Fitbits in my house. Borrow this Fitbit, take this home, have your kid wear it 3 or 4 days, bring it back, let's take a look at it. Let's see if there's potential. Do a complimentary, I don't care, do it for free. Let's see if it happens. And what happens is these parents see, is it the most exact? No, but they're seeing disruptions in their sleep. Oh my gosh, Dr. Jill, what does this mean? What could this mean? So it's just a way to identify a potential problem that they didn't even know they had. We also then introduce a rescue appliance to help these kiddos immediately not only resolve their poor oral habits, but then reinforce the proper habits while we promote the proper growth and development of those appliances, of their upper and lower jaw. So this is a kiddo with a home sleep test on. Is a kid gonna wear all these attachments? That's weird. Some kids will, some kids won't. If you brand it the right way, hey, you're gonna be this cool robot, right? For a while, I'll be honest with you, we were just bribing them with Fortnite and Raft Time and Minecraft. Hey, listen, if you do this tonight, I'll talk to your mom, I'll negotiate. I'll get you 100 V-Bucks, right? Or I'll get you an hour on Minecraft tomorrow. Done, I'll do it. There's not even any negotiations. They're like, yes, we'll do it. So just depends on the audience. But yes, we can gain compliance with that. We're also going to take a look at the CBCT volume. We want to look at it in a 3-dimensional way, what they're breathing through. Is it a coffee straw? Is it a garden hose? That's the analogy we heard this morning. We want the children to have both the right quality of air through their nose and the correct quantity of air through their airway. Both of those are so important. All right, kid, breathe different, right? No, it's an autonomic response that happens from their brain. It tells them how to breathe. So if we can talk to them, coach them through nasal breathing with mouth taping, which I don't introduce in my practice. I use a Healthy Start habit corrector appliance to help reinforce proper nasal breathing. Oh, I can't breathe through my nose. There's so much, inflammation. Well, part of this is a process, right? We can do a little bit of diet modification, cut down dairy. I had one kid that just couldn't breathe through the nose. I said, how much dairy do you have? I said, do you like cheese? Yeah, I eat cheese sticks. How many cheese sticks do you eat a week? Thinking 4 or 5 a week. He's like, well, I eat about 12 or 13. I'm like, a week? A day? Like, kid, when's the last time you pooped? This is an issue. Let's talk about it, right? So we want to look at maybe their diet a little bit as well. But we want to reestablish nasal breathing and put their jaw in the correct position immediately, right? Yes, the long-term game is to have this beautiful, garden hose of an airway that they're breathing through. But short term, my goodness, if we could put the lower jaw and the upper jaw in a position that opens up that airway so that they're immediately getting the oxygen saturation that they need, they're immediately resolving some of the habits that the parents have filled out on the sleep disorder breathing questionnaire and make immediate difference, that's going to win over some patients. That's going to change the dynamics of some families. Meanwhile, the child, if they're properly oxygenated, if they're not trying to have to compensate all night long to get the oxygen that they need, they're going to enter into all these appropriate sleep cycles, one of which promotes growth and development. They're going to grow the way they're supposed to. I had a little kid in this week. I should have added this in here. She's been wearing the Healthy Start habit corrector for 6 months. She grew 3 inches. Not because now she's she was a tiny little peanut, but now that she's getting into REM sleep and she's sleeping better, it's great. So here's a home sleep test I wanted to show you guys just as a screening tool. This child came in and had an oxygen desaturation of 62%. Holy cow. That kid's dying, right? Research shows brain damage occurs below 84%. So sometimes once we test the kids, the moms say, oh, this is me too. I need to do this. Okay, great. Mom tests. Mom's below 84, and she's like, yeah, for sure. And I tell them about that study. That's where some of the brain fog's coming from. Some of these moms have such horrible brain fog. They have such horrible, oxygen desaturation that they get a cortisol-induced sympathetic reaction to pump more blood over their body. They have horrible adrenal fatigue. They're doing all the things during the day. They're Namaste during the day, the Headspace app, right? They're doing all the things during the day, but at night, they're just pumping their body full of cortisol. So what's it for anyway, right? If you're going to do all the things during the day and then wreck all of that at night, it's like, sleeping beautifully during the day and having enchiladas all day. That's not going to help you either. There's got to be some sort of balance. So on some of these tests, it's just really frightening to see how much these kids are desaturating in the night. So one thing that you can do immediately, you don't need a 3D CBCT. You don't even have to take, a lot of my patients, they don't even want their kids to be exposed to x-rays. No problem. Let's take these clinical photos, take them like bite wings, take them from the side. Hey, let's talk about the facial profile. Dr. Heng showed us some amazing photos today where he traced those, right? We want to see how this child grows and develops. We want to show how these appliances can help actually promote the natural growth, downward forward growth and development of their jaw, right? But if they don't want to have exposure, they don't want to have x-rays, no problem. This is a very educational photo that you can show to parents. Pull it up on the screen and show it to them, right? We can talk about, let me see a picture of your family, for example. They show a picture of the family. Sometimes dad looks just like that too. Chubby cheeks, no chin, double chin, right? And we say, wow, they kind of look alike. Wouldn't it be great if we helped promote the growth of the upper and lower jaw in a relationship so they had a nice masculine jawline, right? People think Brad Pitt's so good looking. He's kind of a dying reference as well, but people think he's so good looking, right? I think he's fine, but the best thing about Brad Pitt is his airway. I mean, he literally has the most attractive airway I've ever seen. Have you seen the development of his lower jaw? He's got to have the biggest garden hose. If I ever met him, that's what I'd say. I don't know how he'd take it, but I would definitely compliment Brad Pitt's garden hose. So this is inexpensive. This is someone your assistant can do with the iPhone. Take a picture of the kid from the side. Show mom. Gosh, there's nothing double chin about this kid. His BMI is very healthy, but look how underdeveloped that lower jaw is. Same thing from the front. We're going to take a look. We have some venous pulling here. We're looking at the thirds of the face. We want symmetry in the thirds of the face. This is an exhausted kid. So the other thing you can do, doesn't cost any money, start utilizing the sleep disorder breathing questionnaire. Healthy Start has a great one. That's the one I use. I throw it into all my new patient paperwork. Any child 18 or under, they're filling this form out. It's a subjective form that the parents are filling out. They rate these symptoms, these outward signs and symptoms that we've already discussed, on a scale of 1 to 5, 5 being the worst. What's really cool is that they can, let's say they accept treatment and they start with the habit corrector appliance. They fill it out the next month. Symptoms improve every single month. Here's the other thing. Maybe we don't close the case. Maybe they're not interested. We still ask them to fill this out. Remember that study where I said that 93% don't improve, 30% actually get worse? We see that. They come back 6 months later for their hygiene appointment. They fill it out again. Oh gosh, the bedwetting, it used to just be a 2. Now it's a 5. And we show them that. I just want to let you know, you filled this out 6 months ago, and here was your child. Now you fill it out today. It seems like these symptoms are getting worse. Would you like to continue the conversation about how we could intervene now? We've identified a problem, and we'd like to intervene now. We don't want to wait. We don't want to see if it gets worse. We see a problem, and we're really excited to say that here in our office we have a solution. Parents are really open to that conversation. But you can't treat what you don't diagnose. You can't treat what you don't recognize. And here's the other thing. I'm not a very good salesman. I've already told you about some of my marketing techniques with just aggressive outbursts on social media, right? Fights in an elevator. I've already told you that that's my marketing strategy. It doesn't always work. Here's what works better. If you can have the family or the parent identify the issue. Hey, my kid is mouth breathing. My kid is stopping breathing. Why did you ask me that? Do you have a solution? You're just a dentist. Why are you asking me if my child bedwets? I'm seeing the pediatrician. I'm seeing the ENT about this. I'm seeing the nutritionist. Do you have a solution? I do. Thanks for bringing up the issue. I do have a solution. So when someone's asking you for a solution, it's much easier than trying to ram it down their throats. Does that make sense? What's the solution? So we need to educate parents and families. We need to eliminate poor early habits early, and intervention. As soon as we see the problem, we need to intervene. So that would mean end pacifier use as early as possible. When breastfeeding, position the tongue below the nipple. The swallowing rate, we want to build in the proper amount of swallow. These kids swallow all the time. So if they have an improper swallow, if they have an anterior tongue thrust, or if their tongue isn't up at the top of their mouth like we heard about this morning, we need to resolve that quickly. They swallow up to 3,000 times a day. So that's just ingraining that habit every single time. We know the pacifier is great for soothing. It's great for bringing the lower jaw forward, right? So to open the airway, just like the thumb and the fingers. But what isn't great is it's directly opposite the natural growth and development of the upper and lower jaw. So rather than breaking that habit, let's introduce an appliance that works, that promotes the natural growth and development, but also gives them the relief that they're looking for with the pacifier. We want to use a cup with a spout by 6 months if possible. And we want to use, again, that appliance early on to replace it. I think I've covered this, but that airway and craniofacial growth and development is in a downward forward direction. Now, we're not looking to develop little Jay Lenos here with these big old chins, right? But when we look at these children's faces, a lot of the lower third is very short. So if we bring them forward, if I have a child in my chair and I see that lower third is very short, I ask the child, bring your lower teeth in end to end. They're bringing their jaw forward. By bringing it forward, we see an improvement in the lip posture. We see an improvement in the jawline. The parent is actually able to envision what we know is going to happen by helping the jaws fully develop, fully realize their growth and potential. It helps the parent see that simply by bringing it end to end. So I would encourage you to ask parents to do that. This is where I'd like for them to be. All right, kiddo, bite down on your back teeth. They bite back down. And this is where they are. So we have to help the upper and lower jaw grow where it's supposed to be. Parents understand that. So I do use the Healthy Start system. It's a series of removable appliances. The material is a bit more biocompatible. So for some of my pickier patients, or I do have a lot of patients with immunocompromised situations or other health things that they're focusing on. So this has been effective, and it helps establish nasal breathing, retrains the tongue, eliminating bad, poor oral habits. What's great about it is, well, let me rewind. My background's in physical therapy. So I ended up basically quitting getting my master's in physical therapy and went to dental school because physical therapy, it was too hard for me. To get people to do the proper repetition over and over again to resume proper function, it's hard. Speech therapy is hard. Myofunctional therapy is hard. God bless the people that do it successfully, because I think it's a really hard profession. I think it gets overlooked a little bit. Not by us, but others. It's a difficult profession to get the proper amount of practice with it. So one thing that's great about the appliances that we're using in my office is it actually it has a myofunctional component built into it. So myofunctional with, built right in, partnered with a myofunctional therapist, my goodness, is that kid gonna improve faster than someone without? Absolutely. So I'm a big fan of that. We're gonna advance the mandible to correct the overjet and overbite. Optimizing TMJ positioning. I love Dr. Gelb says he wants to be out of business. How great would that be if there's no patients for you to treat, right? It would be so great if we didn't get there. Unfortunately, everyone's always going to bang on your door. There's always going to be tons of adults that need your help. But gosh, if we could decrease it, it would be good. Promote the proper facial and body growth and development we know that most of the head and neck growth and development occurs before the onset of puberty. So we'll call that 12. I don't know about you guys, but I'm seeing that early and earlier with some of my patients based on diet and other issues. So we want to get after this early. We're going to expand the dental arches, correct the orthodontic problems so we get ideal overbite, overjet, intercuspation, and a class 1 relationship. We're also going to promote those teeth rather than waiting till they erupt and then moving teeth and restructuring the periodontal ligament fibers that attach the teeth. We're actually going to correct the poor oral habits that have deviated growth. We're going to promote the proper growth and development of the jaws. Then we're going to guide the teeth into the proper position before the fibers attach. So again, the retainer will be the teeth, the muscles, and the periodontal ligament fibers. So they don't need long-term retention. We don't have relapse with it because we put the teeth where they're supposed to go initially. Let's look at a couple cases. I know I'm running out of time. I heard applause next door. It makes me a little nervous. So let's go through a couple cases. Here we have the girl here. She came in. I know this isn't projecting well, but she had quite a few symptoms. Bedwetting, mouth breathing, very disruptive. She came in about 3-4 months later and had complete resolution of all of those symptoms. Here's her brother, comes in, complete overbite, can't even see the lower teeth. Again, tons of symptoms, bedwetting, hard time listening, mouth breathing. You can imagine being the mother in that house. It's very difficult. 3-4 months later, symptoms have resolved. Imagine how different it is to live in that house. Let's follow this kid a little bit more. Progress here. We went from not even seeing this lower lateral, now having not even seeing the lower lateral, complete overjet and overbite. Now we're advancing that mandible. We're bringing the tooth into the proper alignment. Beautiful case. Here he is, pre-treatment, 3 months later, 6 months later. Wearing appliances at night only. Here's another case, complete overjet, overbite, complete underdevelopment of mandible. Mandibular teeth are not too small, right? The mandible is underdeveloped. Taking him through the series of appliances. This is what the appliance looks like with good compliance, aligning those teeth beautifully. We talk a lot about pediatric CPAPs. CPAPs, continuous positive airway pressure, blow air in to hold open that airway, right? They're not getting the right kind of air. No one can process air at the speed that the CPAP's putting it in there. But also, this kiddo of mine was treated at UT Southwestern, low socioeconomic status, couldn't afford to plug in a CPAP. It was electrically driven. So he couldn't wear it because they couldn't keep the lights on, right? So he was able to introduce an appliance that helped him much more. 2-year-old Down syndrome patient, again, he was wearing a CPAP, non-compliant, complete underdevelopment of the maxilla as well as the mandible. We got him compliant with this removable appliance. His mother was extraordinary. That's good. I'm glad that video showed. We're clapping. We're cheering for him. I wasn't restraining him. Pseudo class 3. I know. Well, without playing that video, it looked a little aggressive. So here we have a pseudo class 3. So we're talking so much about underdevelopment of the mandible, but guys, the maxilla can be underdeveloped as well. So we're seeing underdevelopment of both. How do we promote both the upper and lower jaw coming forward? This child wore an appliance, a Healthy Start appliance, 2 hours passively a day and at night. So basically was when he was in the car and was in the bathtub and screen time, and was able to jump that bite very quickly. Let's take a look at another one. Same thing, pseudo class 3, underdevelopment of both. 1 month, we're already end to end. So we're not saying this is going to take 6 years. We're not saying this is going to take, sorry, I'm having a Brittany moment here. I'm not saying we're going to take a long time to get this done. We're going to get this done in a matter of months. So 2 months progress, we've jumped that bite, and we're still on our way. We are still going to promote the maxilla and the mandible moving forward. Here's one of my favorite kiddos, Everett here. Again, a pseudo class 3, all kinds of attrition on his teeth, venous pulling under his eyes, but look, he's smiling. He's a happy kid. Mom thinks he's thriving, and he is. He's a very sweet kid. But you know what? She thought her kid was awesome before. You wouldn't believe how awesome he is now. He's doing great. Star of his lacrosse team. So super fun. Jumped that bite. Took about 4 months. So still working to resolve the mouth breathing, still working to resolve, reestablish nasal breathing, but the kid's really thriving. So if you take anything away from me today, I'd like you to take away that start as early as possible. Educate these parents. And when I say start early, I mean start the conversation. Introduce the sleep questionnaire. It doesn't matter if you use Stop Bang. It doesn't matter if you use the Healthy Start questionnaire. Start using these questionnaires and educating your parents. We want to resolve problems now to prevent issues in the future. We want to prevent oral habits. Look at these children, what they're doing, how they're compensating, and figure out a way to change that. And ideal treatment results are achieved earlier, the earlier we start. So thank you. Sorry I went over a little bit, but I definitely wanted to cover all that. So